Good afternoon, class.
Good afternoon, Ms. Bradley.
Today we're going to venture into basic Medicare billing. Medicare is just one of several health insurance companies that we're going to learn as part of the medical insurance and billing class. All right, I've provided you with a handout of the presentation for you to take with you. One thing I want you to say with me before we begin is, I don't have to know everything.
I don't have to know everything.
I just need to know where to find it.
I just need to know where to find it.
All right, as new billers with as things are today, the sick is always going to be with us. Look, it's going to get rough, but I don't want you to give up. All right. How many of you have parents, family members, relatives, neighbors, ladies down at the church that are Medicare age? All right. So I see that quite a few of you do know at least somebody who is Medicare age. Have you heard of the program then, right? Okay, so yes, you have heard of the program. As we said, I want you to keep in mind Medicare is only one of several health insurances that we're going to deal with. You've heard of TRICARE for the military. You've heard of Medi-Cal, state. You've heard of workers' comp, of course, heard on the job. You've heard of a lot of commercial insurances, Blue Cross, Blue Shield, your PPO, HMO. It goes on and on and on, all right? But today we're only going to do Medicare Part B. A little bit later on in lab, we'll do actually filling out the 1500 claim form, and then we'll even pick this up at part 2 because it cannot be done all in one day. Look, here's an overview of what we're going to cover. We're going to do our patient eligibility, patient enrollment for your physician, your claims filing, the Medicare participation agreement, and the CMS 1500 claim form. So you've got to get it on the form. Billing is no good without having a patient who is eligible. So you've learned medical terminology, you've been through coding at this point, both ambulatory and ICD-9, and now finally we're going to deal with the patient at the front desk. Here's an overview of what Medicare actually means to your patient. What is Medicare? Medicare is a government-funded program for your patients who are age 65 or older, those with certain disabilities. So those who have actually been receiving benefits from the program for at least 25 months. So if they're disabled, they can also qualify for Medicare. It's a big misconception that it's only for our elderly generation. Also, those with end-stage renal disease are eligible for Medicare. It's managed by CMS. You've been acquainted with the term CMS in several of the lessons that we've done up to this point, the Centers for Medicare and Medi-Cal. And then also, the bottom line is Social Security is responsible for the eligibility on your patient. All you want them to do is be ready when they step up to the counter. So all of this should be handled behind the scenes, but I want to make sure that you understand what happens, because if you don't, you can render services to a patient who doesn't know whether they're eligible or not, and basically your physician and both you are responsible. The services have been rendered for free, and you're not in the business to do that, are you? All right. The bottom line here is that it's not traditional A, you go to the hospital, B, you choose the physician of your choice. Normally when you go with C, you are locked into a network. Okay, so usually with Kaiser, you go to Kaiser doctors, you use the specialist that they give you. Yes?
So you can't pick and choose with C?
No, you cannot. All right, so you cannot choose with Medicare C, and that's a big issue to you as a biller. If your patient steps up to the counter and they don't know that they've signed up with an HMO, and many of them don't because they may be approached at a health fair for elderly patients, and they may sign on the dotted line with the promise that they will have a lower health insurance, a lower co-insurance, a lower deductible, not knowing that it locks them into only that particular facility, and they cannot continue to go to the doctor down the street that they've been going to for the last 35 years. Yes?
So one more question.
Okay.
What if they do sign on that dotted line not realizing that they don't have an option to go elsewhere? Can they, after they sign and they change their mind, can they get out of that?
Yes, they can come out of it after a certain period of time. So it's like anything else you do. You go in for a certain period. You've got to wait until the end of the month It's got to cycle through your Social Security. So it can take up to 3 months to come out. But once your patient says, I didn't know what I did and I would like to come out of it, they are given the opportunity to do that. One more question. Let's see how we paid attention. Most people don't pay a monthly premium for Medicare Part A. True or false? True. You're right. If they have at least 40 quarters of covered Medicare employment, it will be absolutely free. All right? 40 quarters, 10 years. There you go. But they like to say 40 quarters because it's going to graduate down. It's going to take too long. All right? Very good. We've made it to the end. Basic Medicare billing Part 2, we're going to save for tomorrow. We're going to return to the lab and fill out our 1,500 claim form. All right? Okay. Any other questions? No. All right. Thank you so much.